Hi guys! Welcome to today's video about 5 unexpected signs of liver disease. Did you know that the liver is one of the most important organs in our body, responsible for vital functions such as filtering toxins and producing bile? But what happens when it isn't working as it should? It is to answer this question that we will explore the 5 unexpected signs that may indicate the presence of liver disease. Pay attention to each one of them and be surprised by the last one. Before showing you what these signs are, it is very important to understand that liver disease can take several different forms, including liver cirrhosis, hepatitis, and even liver cancer. Think about this. Those factors we talked about can majorly impact how healthy you feel. Without further delay, let's get started. Number 1. Chronic fatigue. You may think you're just tired from your busy lifestyle, but constant fatigue could be a sign that your liver isn't working properly. Chronic fatigue is much more serious than just feeling tired after a long day or a bad night's sleep. It is a persistent feeling of exhaustion that does not improve significantly with rest and can drastically affect your quality of life. In the context of liver disease, fatigue can be one of the first warning signs. It occurs due to the liver's inability to eliminate toxins from the blood efficiently. Picture this. Accumulated toxins acting as unwanted guests in various nooks of your body, including the brain, which could be why that always tired feeling has become your new normal. Fatigue associated with liver problems can be accompanied by other symptoms, such as difficulty concentrating, mental confusion, and, in more serious cases, hepatic encephalopathy, a condition that affects brain function and can lead to changes in personality and behavior. 2. Change in the color of your urine. Pay attention to the color of your urine. It can say a lot about your health condition. If you start to notice that your urine is consistently darker, this could be indicative of liver problems. Dark urine is often a sign that there is an excess of bilirubin in your body, a condition known as jaundice, which is a strong indication of a malfunction in your liver. 3. Tendency to bruise or bleed easily. When your liver's out of whack and can't make the proteins needed for blood to clot, healing those cuts and stopping too much bleeding becomes a big problem. When the liver is damaged, its ability to produce these proteins is compromised, leading to an increased risk of bruising and bleeding. Another thing about liver disease is it can reduce the number of platelets in your bloodstream. This condition? It goes by the name thrombocytopenia. Platelets, those tiny warriors in our blood, play a big role in clotting. If their numbers drop too low, you might find yourself bruising or bleeding more easily. A simple touch or pressure can result in bruising in people with advanced liver disease. Even common daily tasks, like brushing your teeth or wearing tight clothes, can cause unexpected bleeding. It is necessary to say that although the ease in bruising and bleeding can be worrying, it is a sign that the liver may be suffering and needs medical attention. It is not something to be ignored or treated carelessly. 4. Jaundice, yellow pigment in the skin and eyes. Jaundice is a condition characterized by a yellowish tone in the eyes and skin. This is one of the most classic and well-known signs in patients who are suffering from liver problems. Those who present this sign may also have changes in their stool. Pale, grayish, or clay-colored stools may indicate liver problems, as this suggests that there is little or no bile being released into the intestine. 5. Swelling in the abdomen or legs. These signs can often be confused with milder swelling caused by other illnesses, so we must be careful. Ascites is what you call it when fluid builds up because the liver has high blood pressure. In addition to being a visible sign of liver problems, ascites can lead to complications such as difficulty breathing due to the pressure exerted by the fluid accumulated in the diaphragm, the main breathing muscle, and bacterial infections, known as spontaneous bacterial peritonitis. Diagnosing ascites usually involves a physical exam, where the doctor may notice the distended abdomen and, in some cases, perform a paracentesis, a procedure that involves inserting a needle into the abdomen to take a sample of fluid for testing. What are the potential factors that cause liver disease? Let's chat about what leads to liver disease. It's quite the list, from your daily habits to your DNA blueprint. They are diverse, so this topic is very complex. Your liver's health can take quite the hit from different kinds of liver diseases, all impacting it differently. Viral infections, such as hepatitis B and C, are important risk factors as they can lead to chronic inflammation and eventually cirrhosis or liver cancer if not treated properly. Excessive alcohol use is another common cause of liver disease, known as alcoholic liver disease, which can progress from steatosis, fat accumulation, to more serious forms such as alcoholic hepatitis and cirrhosis. Carrying extra weight isn't doing any favors for our livers. It invites an unwelcome guest named non-alcoholic fatty liver disease. Fat accumulates, sparks inflammation, and without intervention can escalate towards cirrhosis. Besides, running into certain chemicals and medicines, along with a handful of uncommon genetic issues, can really throw a wrench in how your liver works. Spotting liver issues early on and actively preventing them makes a world of difference in stopping the disease's progress. What can you do to protect your liver? To shield your liver from harm, adopting some forward-thinking habits now can make a big difference in avoiding diseases later. Adopting a healthy lifestyle is the central pillar of this prevention, which includes a balanced diet rich in fruits, vegetables, fiber, and lean proteins, as well as regular physical exercise to maintain a healthy body weight. Moderation in alcohol consumption is also important, as alcohol is a toxic substance for the liver. Limiting or eliminating alcohol consumption can prevent the development of alcoholic liver disease. You've likely heard that alcohol can be very harmful to the liver. Ever stop to wonder why though? Drinking too much can really throw a wrench in the works for your liver. This powerhouse organ needs to fix and regenerate its tissues regularly, but alcohol puts those crucial tasks on the back burner. This occurs because alcohol interferes with the biological processes that promote liver regeneration and can induce the death of liver cells. Over the years, when our liver struggles to heal amid constant inflammation and cell harm, it sadly paves the way for severe and irreversible diseases of this vital organ. Besides all that jazz, when you drink alcohol, it kind of hijacks how effectively your body absorbs necessary goodies like vitamins and minerals, putting extra pressure on your liver, along with messing with overall well-being. For anyone keen on maintaining their liver's well-being while avoiding ailments from alcohol, easing up on the drinks or opting out entirely could be a smart move. If you have issues with alcohol, it's important to understand that, from a scientific standpoint, the amounts considered safe to avoid compromising your liver functions vary depending on several factors, including your age, gender, overall health, and genetic predisposition. Generally, moderate drinking is defined as up to 1 drink per day for women and up to 2 drinks per day for men, according to guidelines from health organizations such as the Centers for Disease Control and Prevention and the World Health Organization. A drink is often quantified as approximately 14 grams of pure alcohol, which is equivalent to 12 ounces of beer, 5 ounces of wine, or 1.5 ounces of distilled spirits. However, it's very important to recognize that these guidelines do not necessarily apply to everyone, and for some individuals, any amount of alcohol may pose a risk to liver health. If you've got something like hepatitis or fatty liver disease bothering your liver, consider how tossing back drinks could make things go from bad to worse in terms of health troubles. And get this, sometimes it's not about how much you drink, but rather your genetic code deciding if those glasses are going to leave a mark on your liver. Therefore, if you are concerned about your alcohol intake and its impact on your liver, the safest course is to consult with a healthcare professional who can provide advice tailored to your specific health situation. Depending on your past medical experiences and where your health stands today, they might suggest cutting back on drinking or quitting alcohol completely. Getting a shot for viral hepatitis, when it's an option, is your best bet to avoid infections that might lead you down the path to chronic liver issues. Steer clear of illegal drugs, and don't share stuff like needles or razors that could pass on viruses. Watching out for things that could harm the liver, think problems like diabetes or too much cholesterol, really matters when you're aiming for overall health. Keeping tabs on our liver's health through steady appointments for checkups and blood work is like having a sneak peek at potential issues. If anything seems off, we're already one step ahead in dealing with it swiftly. We're crossing our fingers you found this video both enlightening and useful. If you liked it, don't forget to give it a thumbs up, share and subscribe to our channel for more health content. Remember, if you see something unexpected, it's a best decision to get in touch with a medical expert as soon as possible. Catching liver disease early and starting treatment can really turn things around. Early diagnosis can often mean the border between life and death. Always be alert to these signs. Looking after your liver is basically like giving your overall health a big high five. For a healthy liver, nothing beats the dynamic duo of eating right and staying active. Before you leave, I invite you to watch 2 more recommended videos popping up on your screen right now that I'm sure you will enjoy. Grateful for your time today. Let's meet again in my upcoming video. Don't forget, staying fit and minding your wellness matters a lot. Stay healthy. Bye.